multiple mentors for different things.
Yeah.
Yeah.
And there is no mentor only appears when you are ready, right? And you are searching for somebody to. Otherwise, if you are not aware and if you are not searching, how even though people are around you who can guide you, but you will not be able to see it. That's the beauty of our mind. That's what we are talking about, right? Mind
You have to
sees
be aware and you have to prepare.
And
Yeah.
mind sees only that thing which we are allowed it to think or see.
It to think and see.
Yeah, right. So
Yeah.
fantastic. Yeah, it's an incredible journey. Thanks so much for this, your passion.
And also, I like to appreciate one thing more about you people, like as a homeopath, having a conversation and having people like allopathic doctors with us. So they are not supportive, but
so welcome once again for this Hall of Fame interview. And in this episode, we will be talking with Dr. Kriti Sood. She is homeopath and from Chandigarh. She has multiple roles in her life, and she is a life coach, being author. She is doing a lot of work beside primary things in the homeopath, and she has been doing it for last 12 years, I guess, more than 12 years, and she has now 2 clinics in Chandigarh. So it's pretty successful in a homeopathy domain as well as the other passionate thing which she does. So thank you so much, ma'am, for joining us, and we looking forward to this exciting interview.
thanks a lot, sir, for inviting me here.
We are glad.
And ma'am, congratulations for getting the Hall of Fame award for performing something substantial in the homeopathy and after joining our academy. So I
Thanks a lot. Thank you. Thanks a lot.
So,
it's a pleasure for me.
Yeah, just I just wanted to understand that being a homeopath, how has been your journey? How do you did you start directly from your college and you started clinic to your private practice, or did you did some job in between? And then what has been your journey for listeners to understand your context?
Yeah, so like we doctors, as you are also both, and Pranav sir is a doctor. Yeah.
Yes.
So like you can very well understand that in beginning, and I am like an amateur. I don't have any background as a doctor.
Okay.
So it was So it was not like so easy for me in the beginning. So I started doing practice at a clinic along with my education.
Okay.
In the 4th year only.
Okay.
So yeah, and like afterwards also, after completing my internship also, I practiced at a clinic with a doctor only.
Okay.
For 2 years, and he's my senior, and he has always been so supportive, my mentor,
Okay.
Dr. Didar Singh. So
Very nice.
he's running a very successful clinic in Punjab.
Okay.
So yeah, he has been always an inspiration for me. So
Right.
that was like wall supporting always, and not like physically, but it has always been inspiring, and he is always there mentoring us and pushing us.
Wow.
So that was my start, and accordingly, like I also did my master's in public health from Punjab University. Yeah. So that was a break in between my practice.
Okay.
But that experience was also very good because I got to learn from so many good professors at PGI and Punjab University. So that was also a very good experience. And where I realized that only giving medicine is not important to the patient, but also like educating them and for adopting good, healthy changes in their lives. That's also equally important. So that was a great journey for me. And then I made up my mind that I'll not go for a job and I'll set up my own clinic. And that was also altogether a decision where I didn't get much support Like from my family also, like they were
Exactly.
saying that job is more secure, more
Job is
safe. Yeah,
yes.
yeah. But like my mentor, Dr. Singh, he always said that do your own practice where you will feel more satisfaction there rather than going for a job and just putting yourself in an environment where things cannot meet up to your standards and all.
Correct.
You might be facing such things,
Right.
but in your practice, you can do what you like, how you want the things to be done. So you will have a freedom there.
Yes.
And at that time, I also lost my father.
Oh,
Yeah,
so
yeah,
sorry.
yeah. So like that was really a tragic event for my family and me as well. And that also like at that time also I made up my mind that I'll not be able to leave my family, because in job you have to also
Yes.
like change your place as well. So that
Correct.
was not that was practical for me at that time. So I thought that I'll go for my clinic, and I started my clinic from my home only. So
Okay.
it was not a fancy affair. So it was just a simple thing. I started my clinic from my home and from a room, and that clinic is still running and it's going successful. And then when my mother saw that I'm doing good in my practice, then she supported me, and due to her
Okay.
support, like I set up my another clinic
Okay.
in the town, and I took some loan also for
Okay.
that. Yeah. So, but and that time I just started doing camps. I started from that. I started doing health camps, and I knew that at that time also, like just starting the camps, you don't know that whether people will come or not. It's just
Correct.
a risk, right?
Yeah.
So, but I took that risk. And from camps, people didn't start just coming the next day. It was a waiting period, it was patience and all. But eventually, people started knowing and starting knowing me as a person, about me, and gradually the things started building up.
Right.
And now I'm running the clinics, and from there, like in homeopathy, we give very much importance to the uh, overall environment the patient is living in, their childhood,
Yes.
and everything. So it is a part of our history taking and all. So
Okay.
there I realized the people are in so much pain, they are suffering so much.
Yes.
So there I thought that like I am giving them medicine, they are getting fine, they are feeling better, and then eventually after an year or so they again come to me with some other health problem. So I thought that like how I can help them so that they don't again, because mental health is, being doctors we realize that if your mental health is good, you will be physically fit also.
Yes.
So I wanted to empower them so that they can take care of themselves in a good way, and they can lead their lives with a fuller, in a
Correct.
fuller way, like
Yes.
yeah, and take themselves out of these and lead a good life. So from there I just got into like and moreover after like having a tragedy, like I lost my father, I also thought that I also need some healing for myself also.
Yes. Yes.
So I learned NLP,
Okay.
neuro-linguistic programming. Yeah. So that was also awakening thing for me also, and how I got to know that how our mind works,
Yes.
and many things are related to our mind only. Like this is
Correct.
not the things are not real, but our mind makes us to believe that these things are real.
Correct. Yes.
So by understanding those things, I was able to help my patients and also myself.
Okay.
I got to understand human behavior in a deeper way,
Yeah.
and how to communicate, and how to make things more simple.
Yeah.
So in that way, I started helping my patients also. And after undergoing the NLP training, then last year, I got to connect with you
Okay.
people, and from there I learned the many other things also. In being a
Fantastic.
doctor, like how to, like I realized that until and unless you don't come, you portray yourself in the market, and you don't we people inhibit ourselves, so
Yes.
we
Yeah.
need to get out
Open
of
up.
our comfort zone, and like then only we will be able to help the people.
True, true,
If
true.
people don't know us, then how will be able to help them out?
Right.
Yes.
So your community helped me a lot in that. Thanks a lot for that, sir.
Thank you so
So
much.
yeah,
Thank you.
yeah, and
It is
then
a
also
privilege to have a student like you.
thanks a lot, sir. Thanks a lot.
So good. So great to hear your actually your whole journey is so inspiring. Because you have gone through that dark phase, and I have gone through, sir has gone through. We understand that
Yeah,
bouncing back from that place,
Yeah.
it takes courage, it takes a lot of things, and then you made that weakness or your that phase into a strength, and now helping others to get out of that phase. So that is a very, very incredible thing, because I think we all three are have a common thing, this
Yeah.
three things, the same thing which we have made into our passion, and now helping people to get out of that pit.
yeah,
So
And the good part is that you got a mentor very early in your life.
yes,
yeah.
That
That
will help
was
you,
that
and
I was fortunate enough.
yes,
and
that
he
Like
has helped you when you're actually swimming against the tide. People were
yeah,
not helping, family was not helping, but still that support was there, which helped you that you can do it and you will do it.
yeah.
After that, you have
That
never looked back and continuously evolved yourself. It is a very,
yeah,
it's a very noteworthy thing.
yeah.
that
That's very true.
true, true.
Because
So
being a mentor at every stage of life, now that's really important.
Yes,
absolutely. Also very I am believer in homeopathy. I take, like, I have medicines here. I keep having a
Okay.
lot of things. Yeah, so I am a very firm
Yeah.
believer of homeopathy, especially for
Oh,
specific diseases
chronic
like
disease.
skin diseases or stomach or something,
allergies.
allergy.
Yeah.
So all those things, I strongly feel this is the best medicine or best pathy to fall on. So lot of people think that there is a less money than allopathy. I have seen a lot of homeopathy who are successful, especially when I was in Kolkata. The Kolkata is a full of homeopathy, the traditional homeopathy.
Yeah.
So
Yeah. Yeah. Here I just got to see another picture.
yes,
Yeah, we
Like
have tried
what
to
I
create a
had.
safe space for all the
Yeah.
branches, and we put all the, everybody who is working in healthcare at a same pedestal. We don't differentiate
Hmm.
between Ayurvedic, homeopathy, or
Yeah. There was no
Ayush.
bias here.
There's no bias.
Yeah.
and
Everybody is
Yeah.
serving
Yeah.
humanity, and everybody is important.
correct.
Yeah.
We believe that every pathy is one and the same. It's a different path to the same end goal, right? Just like
Hmm.
every
Hmm.
religion is has a different like different path to one God. So that is exactly same in
Yeah.
the
Very true.
medical field also, and especially our community, as you have seen that we talk about entrepreneurship, right? We talk about growth,
Hmm.
transformation, helping people. How do you do charity? Now this is beyond your specialization, right? This is not limited to one person, or even non-medical people are there in the community who are running
Yeah.
hospitals, right? So if we
Yeah. Yeah.
empower those non-medicals also to build something, they will give employment to doctors, they will give employment to nurses and staff boys, and then they are able to serve so many people, right? So in a
Very
way,
true.
whether it is medico, non-medico, or some other homeopathy, ayurveda, what at the end of the day, we are helping the humanity. That's the main
Yeah.
mission.
Yeah.
Very important part about your career is that you have closely worked with the holistic health and mental health along with the physical tablets and all those things. So that has actually
Yeah. Very
been a
true.
game
I am
changer.
also certified coach now with Arfin Khan,
Okay.
Fantastic.
and I am helping people to get themselves out of their comfort zone and transform themselves.
Yeah.
And
Nice.
also, I have written a book also recently. I'll
Very
show
nice.
you. So this is my book,
Okay.
Me No Pause.
Me no
Acha,
pause.
Yeah,
acha. Okay.
Very good.
yeah.
Okay.
Nice.
No,
Fantastic.
So
Congratulations.
very good.
thanks
For
a lot.
writing. So many people, almost I think 40 people or 40, 50 people in our community has written book. And
Wow.
There is a book coach. He's a very good friend, and he came into the community, and they signed up for their program, and they have already written so many books. So we have around 40
Great.
authors in our community now.
Once you write a
Wow.
book, you become authority in that
Yes.
subject.
So
They're considered
this
actually.
book is, yeah, this book is all about the lives of my female patients.
Okay.
So I have just given voice to their stories, and
Nice.
like how as a woman we can empower ourselves, our
Correct.
families.
Fantastic.
So yeah, this book is all about it.
Fantastic.
So, and like the thing I realized in like joining the community, and like we people have the potential in us, but
Yes.
just we need some mentor, some guide to
Guidance.
support us and to make us realize that yes, we can do it.
Yes. That's
So
true.
just a push is required.
That's
That is
true.
what we do.
Yeah.
Just a dhakka.
Yeah.
That's the push.
Yeah. 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 Yeah.
Otherwise,
Because everything
all
is
problems.
yours. The talent is with you, skill is with you,
Yeah.
knowledge is with
Yeah.
you, confidence is with you, but just you need a push.
Mhm.
Yeah. Very
And
true.
when you are surrounded by people who are doing something, taking
Yeah.
action, you also feel that I have to do
You
it.
can do it.
I have
Because
to do it.
so many people are doing it. That means I am living some. So atmosphere, the environment changes for you a lot. So change your
Yes.
environment,
Very true.
people surrounding you. You change your future. You change your future. You change your luck. So it's all
Yeah.
interrelated. All interrelated.
Interrelated. The kind of company you have,
Yes.
that is going to build you.
Yes,
Yeah.
yes, yes, fantastic. So, I just wanted to understand how do you manage two clinics, and are you taking help for like digital stuff or telemedicine? Are you able to do that?
Yeah, like people to help me out,
Mm-hmm.
and also like for appointments, like I used to feel a bit difficulty because
Okay.
today in today's time, time is so far fast now that for
Yes,
follow-ups and all, people just forget.
yes.
So to make them accountable and to push them, I just had a software with me.
Okay.
Okay.
So I just that manual task I reduced
Mm-hmm.
Okay.
for calling, for appointments.
All right.
I had a software. I bought a software for that.
Nice.
Okay.
Yeah, and on that I just and patients were so much satisfied. Thanks, they were thanking me that just we get the reminder and we get to know that our appointment is there, and
Yes.
also for prescription and all, everything on software.
On software. Very
So
You
nice.
use
I
the
reduced that manual work.
automation in your.
Yeah, it's automatic. It's automated.
Very nice.
Yeah.
You have used PMS, practice management software.
Yeah.
Good, good. And how about the how do you engage people to for a longer term? Like homeopathy is that kind of stream. Before coming to that part, I will like to know the belief you like believe in your own pathy, like homeopathy. A lot of people who come outside, like they are young people who are come as a doctor, they do not feel so confident that they do not believe in homeopathy, so they divert into different stream, leaving what they have learned for 5 years. So what do
Yeah.
you, how do you had that belief, and what do you advise other people to start their own practices?
What I realized in my journey, that having a good mentor at the right time
Is
in your
that
life is very much important.
it's a
Your
decision?
mentors, yeah, because if you see the people who don't have, I had some teachers in my college only who didn't
Hmm.
have belief. So
Right.
what belief they will instill in the students?
Students.
They
Yeah,
themselves will be doubtful that whether we will be able to do it or not.
yeah.
True, true.
Basically, you should
So
search for
having,
a mentor initially in your career, and you will be getting it if you really asking for it. And that is when
if yeah, you should have that inner drive, and in you should have that connection to yourself,
Connection. Yes.
yeah,
and
I
that
think
connection will connect you to somewhere.
correct.
and the
What I
mentor will
realized.
actually see and show you that actually it works. And once you see
Yeah,
it, then you will be believing it.
yeah.
So having
But
mentors is
you
very
must have that
important.
drive.
Must
You
have
The
it.
must have
drive.
that drive in yourself.
To do something, right? Do not
Yeah,
see
and a
the,
focus.
and focus. Yeah. Do not see the cut like shortcut path. There is no shortcut
Yeah,
in life.
there is no shortcut.
So
And like before doing your practice, you should you should have some like initial practice with some mentor and like then
even
like
even if you are not paid, you should have that experience with the paid
you
member.
should have experience. You should not go on like earning like
Mm.
I'm getting this much earning from
Okay.
here.
Mm.
This is a package. This is a good job. Don't go
Mm.
for that.
Mm.
Just improve your skills. Focus
Yes.
on improving your skills. And if your skills are like completely like
Mature.
जैसे उसको बोलते हैं कि like diamond comes out of the
Out
coals
of
only
cutting,
na
after cutting, yes, yes, yes.
after cutting and all.
Mm.
So it requires time. It requires effort.
Yes, yes,
And then you can shine and you can do in
yes.
your field, and you should have belief in yourself.
Belief,
If you don't,
believe, focus, having mentor, and do not go for easy money in the start. Do some hard work and be
In
in the
initial
market.
times, try to get a place where you actually get the working skills. So not only the knowledge, but actually execution of that knowledge is very important. And
very
especially
important.
once you are in the internship phase, that is a golden time. You are actually going through the trawl, but actually you are learning every single minute. That is the time you should. I mean, you are not earning that much, but actually you are learning. Earning is the important learning. Hota.
Learning, yes.
And moreover, like just the patients who come to us now, like they are coming us with so much trust.
Yeah.
So to deliver it fully, it's our responsibility also.
Yes.
Yeah.
True, true.
So we should have that in our mind that if we are doing shortcut in our practice, so that is the message we are delivering to our patients also.
Yeah.
Yes.
And patients do realize it.
Yes.
You are a responsible person when you are actually dealing with somebody's healthcare. You're actually very responsible, and you have to take that responsibility because whether you are a surgeon or in medicine, he is putting trust on you and he's putting his body for you. That is all he has.
So, and building that trust through your communication, through your practice, through your services, it all depends on you.
Correct. As a like I am German based knowledge and all those things. So they then I have seen in Ahmedabad and a lot of members in our community. They are very good charging. They are charging quite heavily, and people are paying it, and they have results to show, and people are loving it, and they're also wealthy enough. So it is not that you cannot earn money. If Dr. Batra can build a 1,000 crore brand out of homeopathy, then any homeopathy, if you do the proper thing, you can do it. It's only up to that how much hard work you are putting it, how much belief system,
and the quality of services you are giving.
Patient experience that you are giving.
So that's and we, as you know, in the community we have also have a Doctor's Batra's case study for homeopath. I have loaded in, especially in homeopathy we have
in
homeopathy module we have uploaded that case study. If you have not seen, go and see it. Branding, what do you say, a branding case study, not only for homeopathy but everyone else, every doctor should see that. Okay, but we are putting in homeopathy because he is a homeopath. But the kind of activities and the initiatives he has taken in 80s, lot of doctors after 40 years now they are not doing it.
Still not up to it.
Not doing.
In 80s and 90s, when there was no internet, when there was no computer connected either. So what activities he has done that time, that is the one of the reasons like no other brand has come up to that peak in a homeopath. Because people have not put the effort. Maybe some kind of belief system, somewhere they do not have that much of marketing knowledge. Lot of in our community, lot of people think that marketing is not good or not allowed, or we are not, it should not be done as like kind of advertisement. But we believe that until unless, and you also felt same thing, that until unless you show the good thing that you have done to the public, how people will come to know.
How people will come to know. Marketing in a right way, with a good intention, is good.
Yeah,
it's actually you must do it because it is the way you are serving the people.
Yes, it is service.
You are serving the people if you are giving good quality of care and good price.
Yes.
Yeah.
If you are not doing it, it is disservice to your knowledge, disservice to the people who have invested, because society is also invested so much in making one person doctor. So,
and moreover, like sometimes we don't have belief in ourselves only. We underrate ourselves.
yes.
Yeah.
So we hesitate.
Yes. So
But we should come out of it.
How has been your experience in the academy, and how have you, like, you got a lot of things and you implemented also? So what people think that maybe academy is for only allopathy per person, but we have a lot of homeopathy. So what is your message to people who are yet to join the academy?
Yeah. So like I'll like to say everyone, like what we were repeating also earlier, that you need a mentor at right stage. So if you need to grow, if you are doing the same thing same way, the change is not going to happen. You have to change your ways, and there should be a person with some good expertise, good experience, and a good intention to help you out. And this academy has a good intention, has that expertise also, and I have got good results from here. So that can be like accomplished by anyone. Just have some faith.
Yeah, and take action. And take action. Same action cannot give you a different result.
Bring the change.
So you need to change your actions.
Don't just listen, go home and sleep. Get up and work.
And moreover, your environment is like that ऐसा है, ऐसा ही रहेगा, क्यों कर रहे हो, बिना बात के पैसे खर्च रहे हो. So that is a like language, common language in our environment. But we should just like have the courage to think and act differently. Yeah.
Yes. True. So fantastic. All of people who are listening to this interview, I got they must have got a lot of value, motivation, and inspiration. And if you really want to know how we can help you and take your journey forward, you can register for the upcoming webinar, which is the link which is given below this video. Register, click on it, register, and we will see you in the masterclass. And
if you want to contact Dr. Kriti, also share below so that you can take guidance from her as well. And thank you so much, Kriti, for a wonderful talk with you. It was really inspirational, and it was really heartwarming to see that every branch is growing and every person in every branch is growing.
Yes.
Thanks a lot.
All homeopathy people, please see and
listen to us.
Thanks a lot.